With us today is a legend, Dr. Paul Nassif. Welcome, Paul.
Brother,
Good
a legend.
to see you, bro.
I like that. Wow.
A legend.
I don't know if I've been
At least
called
in
that.
his own mind.
Exactly.
He needs no introduction, but I would like to tell you, he used to be my neighbor, and we've been friends for many years, and we're colleagues.
Yes.
And we're here in Park City at the American Brazilian Aesthetic Medicine meeting, thanks to Dr. Renato Salz. And you're going to be sharing a lot of information with us about rhinoplasties and surgery and so forth. Thank you for taking time out to join us here.
Yeah.
So tell me, what's your impression so far of the meeting?
Well, I think this is probably my 8th or 9th meeting with
ABAM.
Renato of ABAM.
Yeah.
And I got to tell you, I mean, this is probably one of the most exciting meetings because, one, you get to see all the colleagues, especially from Brazil and Europe, and especially you and I get to hang out.
Yeah.
And especially since we all get back in life and things get so hectic. 2, you always come out of here learning a number of pearls, no matter how experienced you are as a surgeon. And I mean, and this is such a beautiful place to go. A little bit of skiing, a little bit of fun, some great restaurants, but more importantly, really hanging out with my colleagues, good friends.
Yeah, it's a great meeting, isn't it?
Oh, yeah.
And it's a great cause. It's a nonprofit.
That's
and
right.
Renato's charity, and so it's a wonderful, wonderful cause that Renato is supporting. And we're supporting by coming to it.
Exactly.
Yeah. So how's life with the new baby?
16-month-old Paulina, and my beautiful wife, Brittany, and then, of course, I have 3 boys, Christian, Colin, and Gavin. You know, life is fantastic. But being a dad again, a little bit older, to a baby, especially after working all day, come home, and then you see the smile, and you see, you know, the giggling, and, you know, and hold her in my arms and play with her. It's the most incredible thing, being a dad again. I think I appreciate it more since I'm older and more mature. You know,
I hear
fantastic.
that all the time. Guys
It really is.
having a family a little bit later in life, and they've had one, they have a second one. That's great. Well, she sure is cute. We all follow you on Instagram and Facebook and all the others, and she's just such a cutie pie, as is your wife, your beautiful wife.
Absolutely.
Yeah.
Thank you, brother.
So, you know, you've been in this for a number of years, and you have a lot of experience, and I heard you have a crystal ball, actually. Everyone talks about Dr. Nassif's crystal ball, and I was wondering, did you bring it today, and if so, what do you see in the future?
I mean, what I think is going to continue to happen is, you know, the progression of these minimally to non-invasive therapies. I mean, even at this meeting, I saw an incredible device, especially when it comes to body contouring, fat, all these other devices and technology. I feel that it's getting better and better. I feel that as in the next 5 years, we might be cutting a little less. And
we
having more technology, and we already have. I mean, in other words, I got asked this question 5 years ago. And I've already seen now the progression from the last 5 years to now, how there's already been some incredible technology. And then now to the next 5 years, I just say getting better and better. Now, I mean, some of the stuff that, you know, you and I do when it comes to the nose, that's going to always be there for nasal surgery. And some of the, you know, the facelifts and some of the things that really need surgery, that's never going to go away. But I think starting earlier, I think I'm starting to see a few things happen. I'm starting to see patients coming a little bit earlier, especially after being at home, whether it's tech neck from, you know, being on your, you know, your iPhone or your iPad and looking down versus, there's something I call is selfie dysmorphia. And then again, what's happening is these young patients are coming in, they're filtering so much of their looks. So they're coming into the office thinking, okay, this is what I want to look like. Sometimes a little bit unrealistic, but I see that these treatments are becoming more and more, even at an earlier age, minimally invasive treatments. Whether
Fillers
it's a simple hydrofacial, Botox, filler, you know, some type of laser treatment. So I think that as the folks are becoming younger and younger, taking care of their skin more, I think as the technology is going to continue to evolve, so better technology, better treatments, and the population is getting younger that's coming into our office for minimally invasive treatment, even skincare. That's what I see. And I think COVID, I think being home on social media, I think doing Zooms, all that, I think is actually increasing that.
Yep, I agree entirely. Well, thank you very much for joining us today. And I look forward to your lecture later on tomorrow morning. And I'll see you at the faculty dinner tonight.
All right, brother.
Take care, bro.
Thank you.
You take care.